Hello, my name is Beck Williams, and I'll be demonstrating my bed, bath, and personal hygiene care checkout. First, the bed bath, I'll walk in and introduce myself to the patient. Hello, my name is Beck, and I'm going to be a nurse today. And then I would ask him to state his name, his date of birth, and then I would ask to see his medical wristband to make sure everything aligns with the chart. And then I would discuss with the patient what we're going to be doing, which is taking the bed bath, along with performing personal hygiene care. And so we're going to be giving you a bed bath. And so the first thing we're going to do is we're going to lower the rail and adjust the bed to a comfortable working height, a comfortable position. So we lower the bed rail on the side of patient contact, and then we are going to apply the bath blanket. And the patient's going to hold the top while I keep the bath blanket over the patient, and then we're going to take the patient's gown off, and then we're going to, after we take the patient's gown off, we're going to raise the head of the bed 30 to 45 degree angle, and we're going to replace his pillow with a towel, and then we're going to take a washcloth. We're going to take a washcloth and wash his face and his eyes. And whenever we wash his eyes, we're going to go from inner to outer canthus. So we're going to wash his eyes and his face. And I'd ask the patient if he preferred soap and water or just water. And so he said, would you like soap and water or just water? Soap and water. So we you have to, whenever you use soap and water, you got to rinse and dry thoroughly. And then after we do the face, we're going to the upper extremities. So we're going to remove this side. We're going to place this up under the patient's arm, and then we're going to wash his right arm from distal to proximal, fingertips to axilla, and in long, gentle strokes. And then we're going to raise the arm and get up under the arm and around the axilla area. You can apply deodorant if necessary. And then we're going to then rinse and dry thoroughly. Remove the towel, raise the bed rail, go around to the other side, lower that bed rail, and repeat the same steps on his left arm. Next, we're going to wash the abdomen and chest area. So I'll lower the blanket down to the pubic region, and I'll go from umbilical area to the chest in long, gentle strokes. And in a female, if necessary, you must raise the breast up to get up under the breast. And after we do the abdomen and we do the chest, we're going to do the lower extremities. So when we do lower extremities, we do one leg at a time. And you have to one leg at a time and apply the towel up under the patient's leg. And whenever you wash the leg, you go from ankle to knee and then knee to thigh. in long, gentle strokes. So after we wash and rinse thoroughly, we're going to raise the bed rail, go around the other side, lower the bed rail, and repeat the same steps on his left leg. And then after we do the upper extremities, lower extremities, abdomen area, and chest area, we're going to do the perineal area, and I will explain the perineal area later. And then we will do the, after the perineal area, we will do the feet, the hands, feet, and nails. And so with the hands and feet, we will allow each hands or feet to soak 3 to 5 minutes or 5 to 10 minutes. And but if the patient has diabetes, mellitus, or any other disease that affects the nails, then we cannot do that. We cannot allow the patient to soak their hands or feet. So next we'll do the hands. So if we were to do the hands and feet, we would do it in a basin and allow them to soak, and we'd wash and rinse in the basin, and then we would get the towel and we would file and clip the nails of the toes and of the fingers and toes. And then next we're going to get the back area, and this patient does not need assistance, but if he were to need assistance, we would move into the side lying position. So move to the side, move just a little left. And so we're going to raise this back, and we're going to put the towel below his back right there, like so. And we're going to be assessing with the back and gluteus area or buttocks area. And when we wash the back, we're going to be doing in long, gentle strokes. And then whenever we wash the anus and the buttocks, we're going to be washing from front to back. And then after we finish with the full, after washing the back, I'm going to ask the patient if he would like a back massage or lotion applied to his back or any other area, and the patient says no, so he does not want any lotion. So we're going to have our patient lay back on the supine position, and then we're going to place the bed linen, and then we're going to remove the bath blanket. And then I will remove my gloves and perform hand hygiene. And then I will ask him if he needs anything, or if he would like for me to do anything, or if he feels how he's feeling, and give him. Then I will proceed to give the patient access to the nurse call button, and if he has any questions or if he needs me, don't hesitate to call. And then I would leave the room. So then now we have bed making. And then we have oral hygiene. So oral hygiene with a patient, we're going to either transfer the patient. If the patient is able to get out of bed, we're going to get him to go from a bed to a chair next to the sink. But this patient is going to continue to lay in bed, so we're going to get him to get, we would raise the head of the bed to a semi-fowler position at 45 degrees. And we would we'd get the toothbrush, and let me backtrack. Before we do that, I'm going to see the patient, and I'm going to introduce myself at the very beginning. If I'm going to provide this patient oral care or oral hygiene, I'm going to walk in, I'm going to introduce myself. My name is Beck Williams, I'm going to be your nurse. And I will ask for his name and his date of birth and for his medical wristband. And then I will discuss what we're going to be doing, and that would be oral hygiene while I'm performing hand hygiene and putting on gloves. So I will be giving this patient oral care. So therefore I will, there's a towel. I will put a towel below or up under or on his chest at, while he's in the 45-degree angle semi-Fowler position. And so then I will give him a toothbrush if he is able to do it on his own. If not, you put toothpaste on a toothbrush and slightly wet the toothbrush, and then you apply the bristles to the teeth at a 45-degree angle, and go back and forth to around the teeth, and then you rinse your mouth out with water, and you can, if you would like, you can apply mouthwash, and then you rinse that out with water as well, and then we would do dental floss. So I get the floss, and I'd go between each teeth, going up and down on each tooth, up next to each tooth, or up against each tooth. And after I finish flossing every tooth, I would let the patient, allow the patient to rinse his mouth out with water. And after I've rinsed the patient's mouth out with water, I would take my gloves off and perform hand hygiene. And after that, I would ask the patient if he needed anything or if he would like for me to do anything for him, and he says no. So I will give him a nurse button bedside, and I will if he needs me, he can call me. And now we move to fixing dentures. If the dentures need cleaning, so this patient, I would walk in, I would identify myself. My name is Beck, I'm going to be your nurse today. Ask for name, date of birth, and wristband. And then I would discuss about cleaning his dentures and perform hand hygiene, apply gloves, and then I would take my thumb and index finger. If he is not able to remove the dentures himself, then I would take my thumb and index finger wrapped in gauze and gently pull downward on the upper dentures, and on the lower denture I would gently pull up and press down on one side to remove the lower denture. And then I would take them to the sink and put into a basin 1 inch of water, and I would take a toothbrush, and I would you can't, too cold of water will crack the dentures, and too warm of water or too hot of water will warp the dentures and cause them not to fit right. So you need warm water or lukewarm water, and so then I would be cleaning the dentures in a sink or in a basin, and if the patient chooses to keep them out, then we put them in a closed container inside water or solution, and then but if he wants them put back in, we moisturize the dentures and put them back into their mouth. And then next is perennial care. So I'm going to have the patient get into a position to be examined. The prone position, and then I will have this patient I would drape the patient and I would have the one corner on the bottom and one corner at the top so that the patient could be covered whilst they were draped, and then when they were ready for examination, you just pull the cover back. So on a female, you would examine and or before perineal care, I would come in and I would introduce myself to the patient. Hello, my name is Beck. I'm going to be your nurse today, and ask him to give me his name and date of birth along with wristband, and then I would describe or discuss with the patient that we're going to be performing perineal care to them, and I would be performing hand hygiene and applying my gloves. And next I'll be assessing and examining the vaginal area on a female, or as of right now I'll be examining the vaginal area on a female. So on a female, you would examine and assess any kind of redness or irritation to the skin or vaginal area, and then you would wash and dry thoroughly the thighs around the vaginal area, and then you would take your you would spread the labia apart away from the thigh, and you would wash and dry thoroughly each side, and then you would spread the labia apart and go from front to back on left, right, and center. And you go from front to back, and on a male, you would examine the same way, and you would gently raise the penis and apply a towel under there, and then you would hold the penis, and you would take a cloth or a towel, and you would start at the meatus and clean from meatus outward, and then the shaft of the penis, and then you would wash the scrotum, and then you would cover the patient back up after performing so, and then you would further assess any redness or irritation to a male or female, either or, and then you would cover the patient back up, and then bring the bed linen back over and pull the towel out. And so now we have nail care. With hands and feet, you have the bedside table you can push over in here, but with nail care, I'll come in and introduce myself to the patient, and hello, my name is Beck, and I'm going to be your nurse today, and I ask him to give me his name, date of birth, and let me see his wristband, and then I would describe what we're going to do to the patient, or discuss with the patient what we're going to be doing today, and that's going to be nail care, and then I'll be performing hand hygiene and putting on gloves, and then you get the bedside table and you push into the bed, and you get a basin for the feet and hands, and if they have diabetes or any other form of disease that will not allow you to, with diabetes mellitus, you cannot soak the hands or feet because of the poor condition of the nails. So then you would put the feet and hands in a basin to soak for 5 to 10 minutes, and then you would, while the hands were soaking, you would take a plastic file or a plastic in and clean out from under the fingernails, and then you would take them out and you would dry and rinse dry thoroughly, and you would cut the nails in a straight line or curve around the form of the base of the fingernail, and then you would you file the nail, to keep from having any sharp pointy ends. And then you go down here and you assess the feet, and you would cut the nail. You would take and really you would cut the nails, and you would file the nails down, or cut the toenails if needed, and then you would wash and scrub the calluses on the soles of their feet and get those off, and then you would provide lotion or any kind of massage to their feet, or lotion to the hands if they would like, and then you would dispose of all of the nail care equipment and take off my gloves and perform hand hygiene, and then I would discuss with the patient about if he needed anything, he could let me know, and I would give him a nursing call button for him to assist bedside, and he could call me anytime he would like. And that concludes the video.